Hi, today I'm going to explain how to use the Genova stool analysis. It is the GIFX 2200. People have said it's very complicated, so I want to talk you through. So we do have everything out on the table. You have your box, and then I just kind of read the instructions, but I want to show you what to do. So I lay everything out. It is important to read the top 2 to 4 weeks before the test. You want to stop any medications that your provider tells you, otherwise don't. You also want to discontinue antibiotics, antiparasites, antifungals, and probiotics. However, do not change anything until your provider tells you so. Then 14 days before the testing, if you're doing an H. pylori test with your practitioner who should tell you, you stop the PPI. But again, you don't stop anything unless you find out from your practitioner to stop. 2 days before the test, you would not take NSAIDs like ibuprofen, any rectal suppositories, enemas, activated charcoal, any digestive enzymes, laxatives, or bentonite clay, okay? Then what you want to do is you put on the latex gloves, which I'm not going to do right now because I'm not going to be doing the sample, obviously. And then you collect the stool sample. Now, this can be the hardest thing for people. They do give you this lovely little tray, which I find my patients have a really hard time with that. So what I tell people to do is line the inside of the toilet with an unscented garbage bag, like a big one, and then, pee first and then poop in it. And then you'll have your gloves on and then take the garbage bag out and then you can use that for the sample, okay? If you want to use this, you can, but some people find that challenging. Okay, so then there's a little section and you want to, well, first of all, you have to fill out this questionnaire of just your health history and all of that, stool, all that. Then you're going to write down the consistency of the stool, okay? So you put that on the tubes and it'll be either formed, constipated, loose, diarrhea. It says it right down here, very simple. Now we move on to step 5. There is a green tub tube, okay? You remove the cap and you take with this stick some of the stool, you'll have your gloves on, into this, and you collect from different areas of the poop. So all over, take little samples, and then you put some in here and you put it to this fill line, which is the red, and then you shake it up, okay? Don't overfill it, screw back on the top, and then shake it for 30 seconds and do not freeze, okay? Then you put it back in the bag that you took it out of and put it in the refrigerator, and then it says refrigerate. Okay, so that's that one. Then you repeat the same thing with the orange top and the pink top and the white top. So you're gonna put some of the poop in each one of these to the fill line. This one you just put a small amount, maybe it's like 30 on here, whatever you want. Shake it up, put it in here, you're all set. Then with the white top, this one, you're supposed to not exceed 40 ml. So like I said, the 30 ml is fine. Then you get rid of the rest of the poop, you flush it down the toilet, and then you refrigerate these all. These are gonna go back in here, okay, and then keep them in the refrigerator. And you put this in here too, okay? Then you fill out your insurance information, the payment method, make sure everything is tightened. You put your date of birth on each one of the samples, it shows you, and your name, and then you refrigerate them. And when you're ready, you then call FedEx, and they will come and pick this up from your home and get shipped off. So the test requisition form, which is always in the top, your practitioner will have filled this out. So what there should be marked on here is the practitioner's name, their signature, method of payment. If you have Medicare, you check that. If you have insurance, you check that. Or if you're not billing insurance, then the practitioner in the office will tell you how much to pay. The ICD-10 code should be filled out by the practitioner, and they should also cross off what they want to test. If they check the top, then all of this is done. And then if we want to add on other things like the H. pylori or zonulin or yeast, that is checked off. You put your information, your insurance information, and then the prepayment on this. So I hope that explains everything.
So just to sum it up, you'll end up having 4 samples, 3 go in one bag and 1 goes in a bag by itself.
And then you'll have your test requisition, which you can either put back in the top or put it in here, your questionnaire. These are what you put on the tube, so that this is gonna be the date of collection. You'll throw out your gloves. This blue piece of paper that refers to Atlanta, throw it out. This just, again, gives you information on what you're supposed to fill out and not overfill the tubes. That could get thrown out. The FedEx label goes on top. The stool collection thing goes in the garbage. And then this black bag, I believe, is where you put, don't worry about the black bag. I don't know where it goes, but don't worry about that. And then the shipping information can get thrown out too. Okay, so that's it.